Iron-deficiency anemia. Iron-deficiency anemia is caused by lack of iron, often because of blood loss or pregnancy. It's treated with iron tablets prescribed by a doctor and by eating iron-rich foods. Check if you have iron-deficiency anemia. Symptoms can include tiredness and lack of energy, shortness of breath, noticeable heartbeats, heart palpitations, pale skin. Less common symptoms of iron-deficiency anemia that are not usually connected to pregnancy include headaches, hearing ringing, buzzing or hissing noises inside your head, tinnitus, food tasting strange, feeling itchy, a sore tongue, hair loss, you notice more hair coming out when brushing or washing it, wanting to eat non-food items, such as paper or ice, pica, finding it hard to swallow, dysphagia, painful open sores, ulcers, in the corners of your mouth, spoon-shaped nails, restless legs syndrome. See a doctor if you have symptoms of iron-deficiency anemia. A simple blood test will confirm if you're anemic. What happens at your appointment? Your doctor will ask you about your lifestyle and medical history. If the reason for the anemia is not clear, like pregnancy, your doctor might order some tests to find out what might be causing the symptoms. They might also refer you to a specialist for further checks. Blood tests for iron-deficiency anemia. Your doctor will usually order a full blood count, FBC, test. This will find out if the number of red blood cells you have, your red blood cell count, is normal. You do not need to do anything to prepare for this test. Iron-deficiency anemia is the most common type of anemia. There are other types, like vitamin B12 and folate anemia, that the blood test will also check for. Treatment for iron-deficiency anemia. Once the reason you have anemia has been found, for example, an ulcer or heavy periods, your doctor will recommend treatment. If your blood test shows your red blood cell count is low, deficient, you'll be prescribed iron tablets to replace the iron that's missing from your body. The prescribed tablets are stronger than the supplements you can buy in pharmacies and supermarkets. You'll have to take them for about 6 months. Drinking orange juice after you have taken them may help your body absorb the iron. Some people get side effects like constipation or diarrhea, tummy pain, heartburn, feeling sick, black poo. Try taking the tablets with or soon after food to reduce the chance of side effects. It's important to keep taking the tablets, even if you get side effects. Important. Keep iron supplement tablets out of the reach of children. An overdose of iron in a young child can be fatal. Your doctor may carry out repeat blood tests over the next few months to check that your iron levels are back to normal. Things you can do yourself. If your diet is partly causing your iron-deficiency anemia, eat and drink more dark green leafy vegetables like watercress and curly kale, cereals and bread with extra iron in them, fortified, meat, pulses, beans, peas and lentils. Eat and drink less tea, coffee, milk and dairy. Foods with high levels of phytic acid, such as whole grain cereals, which can stop your body absorbing iron from other foods and pills. Large amounts of these foods and drinks make it harder for your body to absorb iron. You might be referred to a specialist dietitian if you're finding it hard to include iron in your diet. Causes of iron-deficiency anemia. If you're pregnant, iron-deficiency anemia is most often caused by a lack of iron in your diet. Heavy periods and pregnancy are very common causes of iron-deficiency anemia. Heavy periods can be treated with medication. For men and for women whose periods have stopped, iron deficiency anemia can be a sign of bleeding in the stomach and intestines caused by taking non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and aspirin. Stomach ulcers. Swelling of the large intestine, colitis, or food pipe, esophagus. Piles. Cancers of the bowel or stomach, but this is less common. Any other conditions or actions that cause blood loss could lead to iron deficiency anemia. If you leave your iron deficiency anemia untreated. Untreated iron deficiency anemia can make you more at risk of illness and infection. A lack of iron affects the immune system. May increase your risk of developing complications that affect the heart or lungs, such as an abnormally fast heartbeat, tachycardia, or heart failure. In pregnancy, can cause a greater risk of complications before and after birth.
Thank you for watching the video. Please like and click on the subscribe button for more amazing videos.